Rogers. My name is Alice. I'm going to be your pharmacist today.
Hi.
So, how are you doing?
I can't deal with this pain on my toe. It really, really hurts and it's bothering me. Like, I can't walk. It hurts so much.
I'm so sorry to hear that. Which toe is it in?
It is my left toe, my left big toe.
Okay. And how long have you been experiencing this pain for?
I don't know, for a while. Like, it just hurts.
Like maybe a few months or over a year?
A few months.
A few months, okay. Well, I'm really sorry to hear that it's limiting your ability to walk. So I see that your doctor has prescribed a medication for you.
Oh yeah, that's what I'm here to pick up.
Yeah. So we have that ready here for you. So I'm just gonna tell you a few things to remember about this medication, and you're gonna repeat back to me what I teach you, so that I know that you know how you're gonna take your medication.
Okay, please. Yes, I need this medication.
Okay.
Like, seriously.
Okay, great. So this is endomethacin, and you're gonna take one capsule 3 times a day for your gout. Okay?
Okay.
Okay. So that means you're gonna take it 3 times a day. Okay?
3 times a day. Am I
different
supposed
times
to?
a day.
Okay, there's
Yeah.
3 different times.
Yeah, so don't take them all at the same time. You can take one in the morning when you first wake up, and then one after lunch, and then take one around bedtime or in the evening, okay?
Okay.
Okay, but there are also a few things to be aware of with this medication. So if you experience any of these side effects, they are rare, but we do want you to be aware of that in case it does happen to you. So one of these is if you get any GI or stomach issues, like if you get any diarrhea or nausea, or you see any bloody stools.
Oh my gosh, bloody stools?
Yeah, so that's a very rare thing that can happen, but it is something to be aware of, that this medication can cause GI bleeding.
But how likely is that?
So it is very unlikely, but if it does happen to you, we just wanted you to be aware of that so that you can let us know, okay? Okay. And then some other things that can happen are if you see a skin reaction starting to happen. That's also something that's very rare, but we want you to be aware of that in case it does happen, okay? And then if you see anything else that seems funny, like if you start to get flu-like symptoms, then you should know that something is wrong.
What are these flu-like symptoms exactly?
So if you get fever or chills, or you just feel really, really tired, that's a sign that the medication might not be the right one for you. So we just want to let your doctor know and work for an alternative medication, okay?
Okay.
So I also see on your medication history that we have some notes about what kind of food that you eat. So do you mind if I ask you a few questions about that?
Oh gosh. I love In-N-Out. I love cheeseburgers. Like, I just love that orangey sauce. It's so tasty. Like, I have to have it like every day. Like, that's basically my diet. Like, that's the only thing I eat.
Yeah, I know, it is really good. But unfortunately, part of the way to manage your gout is to choose healthier food options, like less fast food. So I'm not saying you can't have In-N-Out at all, but if we could try to have it only once or twice a week, like as a special treat for you once a week, and we could think about some other places to eat that you could go, like Panera. You could have sandwiches or salads.
I hate Panera.
You hate Panera? Oh, I'm sorry. What about cooking at home?
I do like to cook.
You do like to cook? Okay.
I'm just so busy, so.
Yeah, I understand. Yeah, so there's actually a lot of meal prep that you can do, like on Sundays to have your meal ready for the week, and then you could still have your In-N-Out, but maybe a little less frequently throughout the week. Is that something we could work for?
I can try.
Okay. Yeah, so that's something that could possibly make your gout better. Yeah,
Okay.
trying to eat healthy, okay? And if you have any questions about that, feel free to stop by and just let us know how that's going, okay? Okay, so just so that I know your other medications, I see that you're also taking atorvastatin. Are you still taking that regularly?
Yeah, for the most part.
Okay, good. So we're gonna keep on doing that. I see that you've stopped the Tylenol, right?
Yeah.
Yeah, okay. So you had that for a dental procedure recently?
Okay. I'm good here.
Okay, so we're gonna focus on the new medication that you have. And I just want you to repeat how often you're going to take it to me so that I know that you're aware.
I think you said 2 times a day?
So it's actually 3 times a day.
Oh, okay.
Once in the morning, once after your lunch, and once in the evening, okay?
Okay.
So you're going to take that 3 times a day.
Okay.
Okay.
I think, okay.
Okay. Well, thank you so much for stopping by today. And do give us a call if you have any questions, okay? It was so nice meeting you.
Thank you.
Thank you, sir.